You can go ahead there, Premier.
Thank you all for joining us here today. Obviously, the new year is not off to the start we all wished for, but let's get hope burning brightly that 2022 is going to be a change year. Like you, like everyone here, I want nothing more than to start referring to the pandemic in the past tense. I feel that bit fatigue as well. And if you had told me a year ago that we'd be starting 2022 with a fourth wave, I simply wouldn't have believed you. But here we are. You've seen the numbers, how one day's record stands until it's beaten by the next day's. But please try to not let this add to your anxiety. Again, I remind you all to keep in mind that our hospitalization rate is low, with only one person currently being treated. Our vaccination numbers are the best in the country, and the booster program is rolling out across our beautiful province. These are positive signs that our defenses against COVID-19 are working. In fact, today I'm joining you from a vaccination clinic in the Big Land with a team of healthcare professionals administering COVID-19 vaccines. Thanks to everyone here helping out and everyone stepping up to get their shot. Of course, we're open to walk-ins, so anyone in the Happy Valley Goose Bay area who wants a dose, please come get a jab. Given the latest dramatic jump in cases, we must immediately pivot to control our spread. We must be proactive. In a few minutes, Dr. Fitzgerald will discuss how we will be moving the entire province to a modified alert level 4 and what that means for all of us. Yes, we've been there before. We know what to expect. We know what's expected of us. And as I've said before, now is a time for precaution, not for panic. This variant is more contagious, and therefore we must be more vigilant. Such a spike in numbers has made contact tracing that much more difficult and time-consuming. That, in turn, has been a roadblock in reporting site exposures. Our healthcare staff, our volunteers, are all working around the clock to try and keep up. But you at home, you can support them. You can do so by listening, now more than ever, to the advice of Dr. Fitzgerald and her team. My friends, we are all vulnerable. Even our own Dr. Haggie has contracted COVID-19 and is thankfully on the mend. We all hope for his speedy recovery, as we do for everyone else in our province who has tested positive. We are all battle weary, but we know the path out of this current state. We know it because we've walked it before, and we did that together. So please, let's lean on each other's strength, as strained as that may be. Collectively, it's more powerful than you think. With that, I'll turn things now over to Dr. Fitzgerald for an update and the news on alert level 4. Dr. Fitzgerald.
Thank you, Premier. Thank you all for joining us today, and Happy New Year to everyone. Before I begin, I want to let Minister Haggie know that we are thinking about him and wishing him all the best as he recovers. Since the last update yesterday, we have 519 new confirmed cases of COVID-19 in the province. 276 of those are in Eastern Health, 64 are in Central Health, 43 are in Western Health, 125 are in Labrador Grenfell Health, and 11 are waiting for region confirmation. There have been 134 new recoveries, leaving 2,925 active cases in the province. Our total provincial case count is 5,582. One person is hospitalized as a result of COVID-19, and just over 3,300 tests were completed since yesterday, with over 404,000 tests completed to date. Sadly, we are reporting another death today due to COVID-19 in the Central region. And I want to extend my deepest condolences to the family and friends of both individuals that passed away from COVID-19 this week in our province. This brings the total number of deaths due to COVID-19 to 20. In just over 2 weeks, we've gone from 30 active cases to almost 3,000 active cases in our province. At this point, the sheer number of cases is overwhelming public health capacity for case investigation. This means we do not have the epidemiological data to show where the spread is or is not occurring. And from the last 2 years, For the last 2 years, our province has fought COVID in containment mode, really, and by identifying every case and contact. That is no longer possible. Our objective right now is to slow the inevitable spread. The reality of this virus is that it's so infectious, most people will acquire it, but our healthcare system cannot withstand the pressure of everyone acquiring it at the same time. We are therefore moving the entire province into alert level 4, effective midnight tonight. This will be effective for a 2-week period, and we will reassess this on January 17th. Under level 4, which is slightly modified from our previous, we need everyone to focus on keeping their number of non-essential contacts low. Your household can interact with your type 10, so up to 10 close, consistent contacts from outside your household. Informal gatherings are limited to only those in your type 10. Gatherings at funerals, burials, weddings, and religious and cultural ceremonies are limited to no more than 50 people or 25% capacity, whichever is less. Physical distancing must be maintained between household bubbles. Dancing at formal gatherings is prohibited except for ceremonial dances. Public visitations are permitted with one household bubble visiting at a time, and wakes are prohibited. Gym and fitness facilities, yoga studios, swimming pools, tennis and squash facilities, arenas, and dance studios are permitted to open with a maximum capacity of 50 people or 25% capacity per room or ice surface, whichever is less. Physical distancing between households must be maintained. Group and team sports, arts, and recreation activities are suspended. Retail stores, including those in shopping malls, can open at reduced capacity with physical distancing, and restaurants can open for in-person dining at 50% capacity as long as physical distancing can be maintained between patrons seated at adjacent tables. There is a maximum of 6 people per table, and buffets are prohibited. There are no changes for childcare services, which can operate at full capacity, and personal service establishments, including spas, aesthetic services, hair salons, body piercing, tattooing, and tanning salons, can remain open in accordance with guidelines. The high volume of cases translates into even a higher demand for PCR tests. To get ahead of testing delays, the regional health authorities have added more resources for testing, and we have removed the requirement for close contacts to have a third test between days 11 and 13. The current wait time from completing the test referral form to swab collection is now down to 48 hours. However, the time for the test to be processed at the public health laboratory is at 72 hours. The lab is running at full capacity. This means the demand for testing is exceeding the processing capacity, and the data we need to assess the outbreak is not as timely as we would like. We are therefore revising our priority groups for PCR testing, and effective immediately, anyone that is a high risk, close contact of a case and has symptoms of COVID-19 should consider themselves a positive case and follow public health direction. They do not need a PCR test to confirm. If you are an employer, we ask that you do not require a negative PCR test for employees in this category. PCR tests are still required for anyone that is a close contact and does not have symptoms, and for those who work or live in high-risk settings such as healthcare or congregate living facilities. As a reminder, anyone that requires a PCR test to travel outside of the province is not permitted to avail of a PCR test through our public health system. You must book a test through a private laboratory. Travelers entering the province that are required to do a PCR test, such as essential workers, can still avail of a test through the public system. We are still trying to understand what impact this outbreak will have on hospitalizations. Early evidence is beginning to emerge from other countries and provinces, but it is difficult to predict how Omicron will play out when you factor in jurisdictional differences, such as the age of our population and vaccination rates. We are trying our best to follow a map for a road that is still under construction. What we are consistently seeing is that 2 doses of vaccine provides protection from severe illness, and 3 doses provide even better protection. 85,000 people aged 18 and older have received their booster dose to date, and regional health authorities continue to add more walk-in and appointment-based clinics regularly in an effort to get as many boosters administered as quickly as possible. Please be patient and continue checking for availability in your region. If we fail to act now, the repercussions in the weeks ahead could leave us with regret. We have to be decisive and proactive in protecting our healthcare resources. And we are asking again for your cooperation and patience as we battle yet another wave of COVID-19, and the biggest wave yet. I know that we all feel that we are done with COVID, but COVID is not quite done with us. Living with COVID means celebrating the good days and summoning all our grit and strength to persevere through the bad days. We are all in the same storm, but we are certainly not all in the same boat, and we all have different thresholds for stress, and not everyone has a solid support system in their lives. So regardless of your circumstances, feeling anxious or lonely is not a sign of weakness, but a sign of being human, as we all are, myself included. If you are feeling alone or disconnected, please reach out to a family member or friend. You can also call the Provincial Warm Line at 1-855-753-2560, 7 days a week from 9 a.m. to midnight to speak with a trained peer support worker who is there and ready to listen. If you are experiencing a mental health crisis, please call the Provincial Mental Health Crisis Line 24/7 at 1-888-737-4668 to speak with a mental health clinician. This service is available to anyone who needs it. Please continue to support each other, stay connected with your family and friends, and hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. Normally we would have remarks from Dr. Haggie, but we're all sending him our best, of course. We do have Mr. Dave Diamond, CEO of Eastern Health, available for questions as well, and I'll now invite questions from the media.
Thank you, Premier. Today we have 7 reporters joining the briefing. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Peter Cowan of the CBC. Please go ahead, Peter.
Dr. Fitzgerald, I want to ask you about a comment you made in your introduction that you think it sounds like it's inevitable that we're all going to get this at some point. That's a scary comment, I think, for a lot of people who spent 2 years trying very hard to not get this. Why do you think we are seeing that shift? And how do you respond to people who feel kind of deflated after all the sacrifice they've made to try and not get here?
Yeah, I know it's not an easy question to answer either, Peter. I think, this Omicron is so much more infectious than what we've seen before. I think, it's going to be hard, and seeing the spread that we're seeing through the province right now, it is going to be hard to avoid. But we do have the tools in our toolbox to protect ourselves as much as possible. Making sure we're keeping our contacts as low as we can, wearing our masks, only going out when you really need to, trying to avoid crowds and those types of situations, gatherings, and also to get out and get your booster shot, because getting the disease is one thing, but getting severe disease is another thing entirely. And certainly we have seen that the protection that's offered by at least 2 doses, but certainly 3 doses is better of the vaccine is it's real, and I think we can all try to do our best to reduce the risk of severe disease. So getting the disease is one thing, but getting severe disease is quite another. And so we do have those tools to be able to prevent that severe disease. And as I've said before, what we have done up to now has not been for nothing. We have been able to be in a very good place with this, and all these outbreaks that we've had have helped us to know what we have to do when faced with something like this. So, but this is COVID and it changes, and unfortunately we have to change with it.
If it is inevitable that most people are going to sort of eventually get this, then why bring in more lockdown measures? Why not just allow the virus to sort of continue to spread, especially with those low hospitalization numbers that we're seeing right now?
Yeah, so the thing with this is that it's spreading so quickly is that what might be happening today may not be happening, a week from now. And so hospitalizations may be very different a week from now. We don't know that yet. We're still learning about, what's going to happen. We've got to look at, we have a different vaccination rate. We have a different age composition for our population. So no jurisdiction is quite identical to the other in exactly what's going to happen. So we're still trying to learn exactly what's going to happen with regard to hospitalizations. And the problem is that if everybody was to get COVID right now, or get Omicron, the sheer numbers of people, even if it's a very, very mild disease with only a very small number of people percentage-wise ending up in hospital, that number could still be enough to overwhelm our healthcare system. So we have to be methodical and we have to be patient. And, we want to try to stretch this out, much as we did in the beginning when we talked about flattening the curve. We want to be able to stretch out those hospitalizations over a period of time. So we want the rate of case rise to be as slow and gradual as possible.
Peter, I think everybody has to remember something that Dr. Fitzgerald said at the beginning. If everybody does get it, they can't all get it at once. And it's not just because of the beds in the hospital, it's about the human resource capacity to deal with people in the hospital, especially around nurses, physicians, allied health professionals who are isolating as well. So these are proactive measures to protect the bed capacity, not just for COVID, but for other disease entities that we know, of course, are ongoing day-to-day medical illnesses, trauma, et cetera, that continue to occur despite COVID-19. And people really need to not lose faith in the vaccines. They do work, as Dr. Fitzgerald says, it's the best defense that we have. So please continue to push the vaccines, and that will prevent the severe disease and the burden on the healthcare system.
Our next questions are from Renelle Legros with All Newfoundland Labrador. Renelle, please go ahead.
I know you're still trying to understand how this virus behaves, but based on what you're seeing in other jurisdictions, are we anticipating more hospitalizations as a result of Omicron here in the province?
Yeah. So at the moment, yeah, we would expect more. The more cases we have, obviously, there's a certain percentage of people who will end up getting sicker with this. So we would expect that hospitalizations would rise as cases rise at this point in time. As I said, we're still learning about the modeling and looking at other jurisdictions across the country and around the world. But at this point, that would be the expectation.
Again, not just about the people in the hospital, though, but it's about the people caring for the people in the hospital and making sure that we have not just a bed, but we have the human resources available to look after them should they require it.
And this question's perhaps for you, Premier. Do you think we should have gone to an alert level 4 before Christmas? Is there a reason why we stuck it out through alert level 3 throughout the holidays? No,
this is a balance that every jurisdiction across the country is currently trying to figure out, and we've always followed Dr. Fitzgerald and her public health team's advice. At that point, we didn't think it was justified. Certainly, Dr. Fitzgerald and her team didn't, and currently we're adjusting as we go. As you've seen today in Ontario, seen in Quebec on New Year's Eve. These are, we're trying to get the right balance of the economy, keeping people's personal freedoms intact, while balancing against the protection of the healthcare system. So I think, the rear view mirror is always, easier to pontificate on, but I think the right decision was made with the evidence available at the time.
Our next questions are from Jody Cook with NTV. Jody, please go ahead.
Good afternoon and Happy New Year. Just wondering if it might be easier for you to indicate for us what the actual modified part of alert level 4 is. So I've got the list in front of me. Everything seems relatively the same. Is there anything that stands out that hasn't been changed or modified for alert level 4?
So I think the biggest thing was the personal gatherings, and then the number of people allowed at a gathering, at formal gatherings. That was different in the original alert level 4 as we were moving out of alert 4. Or moving out of the original lockdown, I guess. And so we have modified that now, just based on, our vaccination rates and taking all of that into consideration. So we did make some changes there, mainly with gatherings.
Mr. Diamond, there are a lot of people who are frustrated that they are once again seeing elective surgeries rescheduled, some for the second time because the first time was due to the cyber attack, and now this. We've had it explained to us that this is likely due to a human resource issue and trying to protect healthcare workers from being put in isolation. Can you tell us how many now are in isolation, whereas last week we were looking around the 500 number?
Yes, I can. I think across the province, we have about 625 staff members who are isolating for a variety of reasons. Some of it is exposure that they've had in the community or folks who have traveled, and some who have tested themselves positive. So there's a variety of reasons, but across the province, there's 625, 333 of those, as of the latest numbers I have this morning, is changing on an hourly basis. The latest numbers I have within Eastern Health itself is about 333 folks who are isolating.
Our next questions are from Brian Callahan with VOCM. Please go ahead, Brian.
Thank you. Just on that last question, would we still consider what other provinces are considering, such as allowing infected or people with COVID to continue to work in our healthcare system?
Level just yet. Sorry, I don't think we're at that level just yet, but I'm sure all three of us could answer that question. We're certainly monitoring the situation closely and taking these measures today to try to protect the hardworking women and men in the system.
And I guess, what kind of assurances can you give now to small businesses and the arts and musicians and other people who are kind of hoping for some light at the end of the tunnel here, but are back to, some feel like they're back to square one?
Well, I don't think we're back to square one. This is certainly a bump in the road. There's no question about it. But as we have been there for them in the past, we will be there for them again. We know that it's particularly tough in the arts and entertainment industry, the hospitality industry, and we will be there to support them. We're hopeful, as you've seen in other jurisdictions, that this wave, as angry as it is, it comes and goes pretty quick, relatively speaking, in the timelines of COVID-19. So there is still reason for optimism into the future, but we certainly appreciate that this was a busy season that would have been profitable, revenue generating for the people in the hospitality industry, for the arts and entertainment, as you suggested. And we'll certainly take that under incredible consideration and be there for them to support them in this tough time.
Thank you.
Our next questions are from Andrew Waterman with The Telegram. Please go ahead.
Good afternoon. Some people arriving at the airport are receiving paperwork stating if they are fully vaccinated and test negative on a rapid test, that they don't have to isolate, which is, a discrepancy considering what it says on the government website. Can you clarify that discrepancy and why people are getting this paperwork that tells them that they don't have to isolate?
I'm not aware that that's happening, but the SMO says anyone who's coming in has to isolate for 5 days and do the rapid testing. There are some exceptions to that for people who are essential workers, who are coming in specifically to do essential work. So I would have to take that back and look into that because I'm not aware.
Okay, and perhaps this has been asked many, many times. How long can these restrictions go on? Is there a time frame? People are wondering, if it's 3 years from now, can we continue to just put these restrictions in place?
Well, I certainly hope not. But we're going to reassess this at 2 weeks, and we'll see where we are with things. Once we start to see the tide turning, I think we'll be quite happy to start to relax some of those measures, but we do have to be careful. We've seen what's happened before when we've relaxed too quickly in other places. So we will be considering things very carefully. But I don't anticipate this will be going on forever.
Thank you.
Of course, Andrew, as you see around the world, and South Africa, and now in Denmark and the UK, there's an incredibly sharp peak but then it seems to fall off. Hopefully, as Dr. Henry and others across the country are theorizing that this Omicron could be the beginning of the end of the pandemic in terms of making it endemic and moving on to the next chapter in all of our lives, all of which we're too eager to write without the words pandemic in it, of course.
Our next questions are from Patrick Butler with Radio Canada. Patrick, please go ahead.
Hello. A number of other provinces have made modifications to their isolation period, making it 5 days or just 5 days. Is that something that you're planning to do here in Newfoundland and Labrador?
We're certainly looking at isolation periods and whether or not we need to or can reduce them. Certainly, there is some evidence to suggest that this variant has quite a short incubation period, incubation period. It's a quick incubation period, excuse me. But some of this will also depend on, how long is the infectious period. So we're looking at that information very carefully and considering it right now.
I'd like to ask a question about rapid tests. And if you don't mind, in your opening remarks, Dr. Fitzgerald, you said the number of tests that were conducted yesterday. Would you mind reminding me of that just so I asked the right question?
I thought there was around 4,000, Patrick, give or take.
Okay. So basically, my question is the following. If there were 4,000 tests and 500 cases, this would be. We've had a couple of days at least now of days when more than 10% of the people being tested have come back positive. And I wonder what that indicates to you, Dr. Fitzgerald, about I guess the amount of COVID that is actually out there. Are we just getting really a snapshot of the amount of the disease that is present in the province? And with that in mind, should we be looking at using more rapid tests to I guess get a better snapshot and to have more people tested?
Well, so if we do rapid testing, it won't give us any better of a snapshot because we don't necessarily know the results of those rapid tests, right? People do them and sometimes they don't always get back to public health. So, but we're certainly watching, we always watch percent positivity closely. And we are seeing, that it is hovering around that 10% or has been a little bit higher at times and a little bit lower. So over the past few days. So what that says to us is that, certainly there is community transmission. It's pretty widespread throughout the community. Right now, anyone who has symptoms, chances are as good as any that it's COVID as opposed to something else at this point, right? So doing rapid testing in the general community, it may help to find some cases earlier, but at the same time, we have to make sure that, we have other situations that we want to use rapid tests in, and there's a finite amount that's available. So we don't want to use that. We want to focus the use where we're going to get the best information, best bang for our buck, so to speak. And so we are certainly looking at all the best places to be using them right now. That's always a consideration, though. So as soon as we have decisions on that, we will let you know.
Patrick, the other metric to look at in addition to percent positivity, which of course is exponentially higher or 3 times at least higher in Ontario and Quebec, is the doubling time, and we're trying to map that out against hospital capacity and other things. And our doubling time appears to be around 4 plus or minus percentage days, which is I know that sounds high, and it is, but it is encouraging compared to what would be 2 to 3 days. So those are the kind of metrics that we're all looking at moving forward.
Our next questions are from Sarah Smelly with the Canadian Press. Sarah, please go ahead.
Hi there. I'm wondering if you can tell me a bit about how, this Omicron wave, how its impacts on our healthcare capacities are different from previous waves.
Yeah, I can probably respond to some of that if you wish. I think the speed and the how widely the infections are in the community are being reflected in the healthcare system. So, one of the things, the 625 staff members across the province who are now isolating is higher than numbers that we've seen in previous waves, and is pretty widespread across acute care and our whole systems. And so the impact in terms of areas being short-staffed and having to adjust staffing on a daily basis is certainly much more problematic this time around than they've been at any of the previous waves. One of the things that is helpful, though, I think, is the decision that we've made over Christmas to extend our Christmas closure out into the first 2 weeks of January. And in large part, that's been done to free up staff for vaccinations. Dr. Fitzgerald talked about vaccinations as being one of the critical things that we can do to slow the progress and ease the burden. And so we have, in consultation with government across the regional health authorities, we've reduced our services for the first 2 weeks of January. And that frees up a lot of staff, primarily to staff up the vaccination clinics, but also gives us some flexibility as we have now to adjust staffing in the areas where we have significant numbers of staff who have been exposed for one reason or another and are currently out of the workplace. And so, those are some of the things. And this, we had this throughout the previous waves, but this is more intense within the healthcare system as it is more intense in the community.
Thank you. And I wonder too, as we shift away from catching every case, what are the metrics we should be watching to get a good idea of how this wave is unfolding in our province?
I think we could probably all talk about that too. Percent positivity, doubling rate, hospitalizations, ICU capacity. I think those 4 metrics in particular give you a pretty good snapshot about how the wave is evolving. Dr. Fitzgerald?
Yes, that's exactly what I was going to say. And, we'll also keep an eye on outbreaks where we see them, especially in vulnerable populations. That's always something that we're very closely monitoring. So, I think we will see a shift away from really reporting every single case. And as we've seen in other jurisdictions, we may have to get to a point where we say to people, if you have symptoms, stay home. That's something that we'll have to consider perhaps down the road. So these are all things that we're grappling with right now and trying to see where things head from here.
Thank you.
I will now go back through each reporter to see if you have one final question. Peter Cowan with the CBC, do you have a final question?
I do, and that's about testing. For people who don't have a car, they're being told to take a cab or to get someone to drive them, which is not always practical. Why aren't there systems in place to make testing more accessible to people who don't have a car?
Yeah, thanks, Peter. It's a great question, and we've had those questions as well. And I think what we've done up till now is on a rather ad hoc basis. We do have the capability for people to be tested within their own home, and our paramedics have helped us with that, and our public health nurses. But it's been as a result of individual ad hoc conversations between public health and individual clients. And obviously, we've seen some scenarios where that's not worked for people, and they've showed up in taxis and other rather awkward encounters to try and get their testing. And so we are certainly aware of that challenge. Our intent has certainly been to be able to accommodate people who would need to be accommodated for lack of transportation and other issues that mean they're better served within their home environment. And so we're even today having the conversation within public health about how to formalize that. So stay tuned. We will be looking to communicate a process, which it's always been our intent to do that, but obviously we've had some people slip through the cracks in that, and we'll do a better job and have a formalized process that's well communicated in the very near future.
Ronelle Legros of All Newfoundland Labrador, do you have a final question today?
Yeah, my question is for Dr. Fitzgerald. I'm wondering if you can speak a little bit more to the symptoms that I guess most are experiencing as a result of this Omicron virus. Is it still being considered a milder virus? And does that have to do with, I guess, the amount of vaccines that we've received, or is it just being considered milder in general?
Thanks. So the evidence still evolving, I think, to some degree, but for the most part, we have seen mild symptoms. The majority of people have been symptomatic, though, and even compared to previous outbreaks, it appears that we have more people symptomatic than asymptomatic, than we've had before. So it does seem to give people symptoms regardless. Most of the symptoms are mild. Many of them are upper respiratory, so nose, throat, that sort of thing. Cough has accompanied some. For the people who have more severe disease, obviously, by definition, that means they have more lower respiratory symptoms, so the lungs are more effective, so they're more shorter breaths. Many of them require oxygen. So that's what we're seeing in not just here, but elsewhere as well. So some of that may be because of the vaccination rates that we have, and certainly, most of our cases that we're seeing right now are in vaccinated people, just simply because most of our people are vaccinated. And so that could certainly have something to do with it. But it may also have something to do with the nature of the variant itself, and that it tends to be much more efficient at replicating in the upper airway passages as opposed to down in the lungs themselves. And so you will see more mild symptoms because of that. So probably a combination of things, but it still can certainly make people quite sick. There's no doubt about that. But what we're seeing right now, for the most part, is mild. But it's so easily transmissible, as we've said before. That's why we have to be so cautious, even with a mild disease.
Jody Cook with NTV, do you have a final question?
So alert level 3, when we were in it, we were going to revisit that on, I think it was January 10th or 11th, if I go by memory, with a lot of lives and businesses on hold here now. That was a benchmark previous. What's the new benchmark for alert level 4? And also with shorter incubation periods, could we expect shorter circuit breakers of alert levels?
Yeah, so as I said in my opening comments, we'll reassess on the 17th of January. And the question about circuit breakers is it's a good one, but I don't think we have the answers to that question just yet.
Brian Callahan of VOCM, do you have a final question today?
Yes, thanks. Happy New Year, by the way. I'm not sure if anyone, but are the recent deaths and unfortunate and the single hospitalization, are they related to the Omicron or the Delta?
To the best of my knowledge now, any of the severe cases that we have are related to Omicron.
Thank you.
Andrew Waterman of the Telegram, do you have a final question?
Yes, apologies if I missed this in the beginning. I was trying to listen for it, but I may have missed it. The percentage of 5 to 11-year-olds right now who are vaccinated. I'm wondering if you have that.
Yeah, so
66%.
Sorry.
66%, I believe.
Yeah.
Okay, all right, thank you.
Patrick Butler with Radio Canada, do you have a final question?
I do. You announced 125 cases in Labrador Grenfell, which is an area of the province that really hasn't seen COVID. I remember previous briefings where you're talking about how important it was to really protect that region because of its limited capacity, how isolated certain communities are, housing situations as well that could lead to transmission. Can you speak to the capacity of Labrador Grenfell to deal with a surge in cases and any measures that are in place to, I guess, protect the system in there, in that area of the province?
So it's my understanding at the moment that Lab Grenfell is managing with their public health capacity. No doubt stretched, but they are doing an excellent job at the moment of really contacting people and getting people into isolation. But as with everything, you know, public health capacity is stretched, but I can't speak to other capacity.
Sure. And Patrick, that's one of the reasons that we're here today with a team helping with the vaccines and the boosters to ensure that others can be deployed elsewhere, recognizing that Lab Grenfell has the highest rate per 100,000 in the rest of the, compared to the rest of the province, especially in the Happy Valley Gooseberry area. So we're here to support them today and the next couple of days. We've also increased our testing capacity, ensuring that they have the supplies they need. And we're always reevaluating, of course. And so you're absolutely right. This is an area of the province that's not used to having levels of disease, and they are a bit more vulnerable because of geography and because of the Indigenous populations. And we're here to support them. I spoke with the Indigenous leaders of Labrador and the island today and offered our full support in any way we can. And we're increasing our testing capacity and trying to make sure that we're interacting with them as best we can to ensure that they have what tools they need to help fight this to protect their own populations.
Sarah Smelly of the Canadian Press, do you have a final question?
Yes, thank you. I'm just wondering, Mr. Diamond, can you give us an idea of like how far back, how much backlog was there already due to the cyber attack?
Well, we've, I mean, throughout the whole of the COVID, sorry, can you hear me okay?
Yes.
Throughout all of the COVID period, you know, Newfoundland and Labrador has done better than most jurisdictions in terms of, we've obviously had some shutdowns and some slowdowns of services, and we've been able to catch up more quickly. Had we not had the IT outage, most of our backlog from a COVID perspective would have been looked after by the end of December and a little bit out to the end of March. So the IT outage scenario put us behind by 2 or 3 weeks. And you know, we thought at the end of that, we would catch up on most of that by the end of March. So now we've got another blip, unexpected, not anything that any of us can do about this. So what we thought we would get done by the end of March will be delayed somewhat in totally catching up out a number of weeks, depending on how long this particular wave is. So, you know, we totally understand how difficult this is. This is, we hear from physicians and frontline staff, we hear from patients and families. We know how difficult it is to be waiting for a procedure and to be delayed. We are doing, you know, most of our cardiac surgery and cancer surgery is still going ahead. So that's one of the areas that, you know, has created a lot of angst in other jurisdictions. We will be able to complete those services even through this slowdown. But we're very empathetic and aware and want to ramp back up to the maximum as early as we possibly can when we get through this wave. Having said all that, we feel it's very critically important to do the vaccine campaign, and our human resource within the healthcare system is a finite resource. And so we want to make that a huge priority in the next couple of weeks. And that's a big reason why we've done what we've done. As soon as we get through this, we will ramp back up, do the overtime, do the weekends, do the additional things that we have been very successful with in the last 2 years to try and catch up and get people back on schedule.
Thank you.
Thank you, everyone. Premier, do you have any final comments for us today?
Sure. And just to pick up on Mr. Diamond's comments, as a surgeon, I'm incredibly empathetic to those with canceled appointments. There's nothing more disheartening to tell someone who's waited a long time that they need to wait another bit longer. But these are circumstances beyond our control with finite capacity, as Mr. Diamond said. But please bear with us. We will do our best to catch up as fast as we possibly can. I know I know that all the healthcare professionals want that, and they're willing to work that little bit harder, even though they're already strapped to get us through this. And they're the true heroes in all of this. But I wanted to end by expressing my condolences to the families and friends of those who have lost their lives to COVID-19. And it's a terrible event, of course, and to wish my best to anyone suffering from COVID-19 or with anxiety and isolation waiting for results of COVID-19 testing. Please stay strong. We will get through this together. And I think one of the highlights of today, and one of the headlines perhaps, is, as Dr. Fitzgerald said, we will most likely all eventually get COVID-19 at some point in time. At someday. The key to the alert level change today is that we all can't get it on the same day. If we get it on the same day, that is an incredibly terrible event for our healthcare system and the basic and our first responders, frankly, police officers, paramedics, firefighters. So the measures that we took today, although no one wanted to take them, are important in reducing contacts to enable and protect those people that we just talked about. So please stay safe, look after each other, check on each other, do it safely, keep your bubbles intact, and we'll chat soon.
Thank you, Premier. Thank you, everyone, for joining us today. Please stay safe and enjoy the rest of your day.